What are your thoughts on providing tax credits to physicians who are willing to care for the indigent?
Well, I'll tell you what, hadn't thought about it because I've never had anyone mention it to me. But I can tell you this, if there's an opportunity for us to figure out how to make it easier for those who are medical providers to be able to care for those who have no money and are not going to have insurance, and really fall in that gap before they're old enough to reach the Medicare age, and maybe they don't qualify for Medicaid for some reason, then I think that's an idea worth exploring. I have no idea if any other states are doing it. Right now, I know that the word tax credit is almost a bad word at the state capitol. I think there's ways to set up a performance-based measurement so that you can make sure that the tax credits that we choose to leave in place do provide the incentive that we're talking about. If we can't keep doctors serving that population in the state, then we have a glut in the emergency room, and we have to be able to figure out how to reduce that and have that facility for emergency services as much as possible. If we have an opportunity to figuring out how to help doctors who choose to want to help that indigent population, then I think it's worth talking about.
I just want to add that steering away the uninsured from the emergency rooms would be a great way to help lower our health care costs, and getting them into some type of clinic or service to where our doctors can see them would go a long ways towards reducing one of our most expensive forms of delivery of health care, which is the emergency room itself. I will tell you that I've always supported Good Samaritan type laws that deal with liability of those who want to volunteer your services, and actually ran that legislation too a long time ago. I think that's a great way also to help encourage more physicians to see the indigent care as giving them that cover from the medical malpractice and giving them liability coverage with Good Samaritan laws. But in general, anything that would help us provide more community-based partnerships to where we would encourage more doctors to be able to see those who may not have access to health care because of financial reasons or job loss or whatever it might be, I would be happy to look at. Once again, a lot of things that we'll be doing this year will be based upon the budget and the revenues and how our money comes into the state, but I certainly think that's an idea worth considering and looking at.
Thank you all.